Thank you everybody for joining us, and welcome to the people who have come back. Today what we're going to be speaking about is addiction treatment in the United States. Does it work and why not? And so just briefly, again, I'll introduce myself. My name is Rickard Elmore. I'm an interventionist and a treatment support strategist. I've been in the addiction and mental health treatment field for the last 19 years. And currently, our intention is to open up the awareness or the knowledge base of addiction treatment in the United States and sort of offer a bit of information that most people may or may not be aware of. Today we have a guest, Mr. Mark White. He's the Vice President of Nexalin Technologies, and we will be connecting with him and talking to him a little bit about some of the advancements and availability of technologies that help people get better and sustain that on their own. But before we go there, we're going to speak a bit about what's going on in the United States in the substance abuse treatment industry. We've got over 23 million Americans that are in need of treatment. What we're finding is that a lot of them are being misdiagnosed and are not being cared for in the appropriate way. Being an interventionist, what we do is we find the best kind of care for an individual, no matter what that care may be. And what we found is that a lot of the times people that are being diagnosed with substance abuse problems are really having mental health issues, or they're really having deficiencies. That being said, I'd like to talk a bit about our guest, Mark White here, who's come to connect with us, and we really appreciate you showing up, Mark White.
Thank you.
And I'm really grateful that you're willing to share your experience and what the technology is about. So could you tell us a little bit about yourself?
So I'm Mark White. I'm the Vice President of Operations with Nexalin Technology. Nexalin Technology, the FDA term is that we're a cranial stimulator. More importantly, what we do is we non-invasively stimulate the brain's ability to regulate itself. The subject that we're talking about today is something that I've spent the last year investigating, and I find it very interesting that we're all in agreement about addiction, substance abuse, and other related situations, that they're a brain-based disease. In fact, there's some published material about that specific statement. And I think that the conversation is just beginning there, and that when we talk about some of the inefficiencies of treatment, I think that it's appropriate that we talk about the brain. Because if the brain is diseased, and if it is contributing to the addiction and the chronic relapse, which is going to challenge the quality of care for the patient, then we need to be talking about, first of all, what's the nature of the brain-based disease? How does it manifest? What are the responses to the disease, the symptoms of the disease? Mm-hmm. And then most importantly, what can we do to treat the disease? And when we take that information and that model and plug it into the behavior model that is effective and has had a lot of research over the years, I think that we have the opportunity to be more efficient in our treatment model. And when we're more efficient and we're addressing the disease of the brain, then we have an opportunity to really help our patients. So now how does Nexalin Technology fit into that conversation? Mm-hmm. So when our clients come to us and they're suffering from an addiction, they've obviously been out there on some form of a substance, and this is what we would call toxic trauma to the brain. And this is where the brain disease sort of begins for me, as far as in the conversations that I have with doctors. And the disease manifests by the structures of the brain that are in charge of balancing and regulating its chemical atmosphere, or its neurotransmitters, which is going to relate to cravings and the ability to handle the stressors of life, that Nexalin is able to come in and actually reset those areas of the brain that have been traumatized from the addiction. So when a client comes in currently, we put them into our recovery model, and we talk about the fact, we educate them, I guess would be a better way to say this, that we educate them on the brain-based disease that they have, and we educate them on the disease model. Mm-hmm. Really, the only thing that we're doing for the brain today, or at least the majority of the treatment centers, there are some that have learned about how to treat these brain irregularities, but the majority of them do not address the brain other than through abstinence, food, sleep, and some behavior support. But going back to my point, the area of the brain that's traumatized from the actual ingestion of the chemicals is not recovering in a 30-day period. In fact, there's quite a bit of science that demonstrates that the areas of the brain that are traumatized from an addiction sometimes can take 6 months to as much as 18 months to recover. This is why a patient that's in their first 6 months of sobriety, when you have a conversation with them, you can identify that they're in early sobriety because of the way that their mind is still processing the addiction and the struggle that they're having with the cravings, the sleep disorders, the anxiety, the stress, etc. So therefore, we have developed a frequency, and this frequency will actually talk to the brain in its native language, if you will. It stimulates the area of the brain that is traumatized. And by stimulating that area of the brain, we can actually reset that trauma from the ingestion of the chemicals in 3 to 7 days. And when you reset that area of the brain, we're now offering a brain-based treatment, or what we would call brain-based recovery. And what we see and what the patients report is that within 10 days, the cravings that they have never been able to handle in a comfortable manner almost diminish completely. Because as we know, the science behind the cravings is an imbalance, a massive imbalance, normally associated with dopamine, serotonin, and some of the other neurotransmitters. Now, Rickard, I've simplified this obviously because we don't have the time to go into the brain anatomy. But basically what we're doing is we take a client on day one, and when we start treating them with Nexalin, day one of sobriety, and we start treating them with Nexalin technology, it's almost as if we pick them up and put them out at the 9-month mark from a physiology standpoint, because we are literally resetting the structure of the brain that is dysregulated and cannot promote balance or homeostasis. And when you reset that midbrain, you get an immediate adjustments in your neurotransmitters, which then will reduce cravings, enhance sleep, and offer the ability to the patient to handle the day-to-day stressors of a recovery life, a lifestyle without their dependency. And so this is the magic of Nexalin, and so I've said an awful lot here, so I'm sure you've got some questions specifically, but let me give it back to you and see what you think.
My questions were, and sort of not so much of a question, but more of, it says here that Nexalin is cleared for anxiety, depression, and insomnia. And if I'm hearing you correctly, what you're saying is that in reducing or eliminating, if you will, if that were the case, any one of these or any combination of these, that the results start to become present in very short periods of time. And you mentioned something about the state that the brain is in beginning of recovery, and when you first start getting into recovery, like we all know, there's some old words that are being said that are consistent. If you stay sober for 90 days or 120 days or 180 days, you start thinking clearer, you start making better decisions.
Why?
And this is what I want to make sure that I'm clear with you, is what you're saying is that there's the state inside of the brain that causes you to get better over time, and that Nexalin technology is something that takes the brain to that period of time in a shorter period of time?
It accelerates it, because if you just take the brain and remove the chemicals and then start sleeping and eating, all right, the brain will naturally on its own begin to regulate itself, okay? Because we're talking about trauma here, all right?
So, and I don't want to, but I want to keep going on this because what we really see when people relapse or in the early stages of recovery is what happens is the person that's starting to get in recovery, they start having these thoughts, and they start having these impulsive decisions come up, and they start making irrational choices, right? When they're coming off drugs, or they're coming off of alcohol, or they're coming off medications, because we see a lot of this coming off medications. And And what we're seeing is that their response to treatment in the first 30 days is diminished because they're not into a space to cognitively connect with the information that's being taught. As it relates to that, what do we see from Nexalin if somebody uses Nexalin? How do we see them function?
That inability is related to, as I said earlier, an imbalance in the neurochemistry of the brain. And Nexalin will correct that imbalance in 3 to 10 treatments. And that imbalance is usually present for 6 to 12 or 18 months. That imbalance is what interrupts the patient's ability to interpret consequences of behavior, to make impulsive decisions that are not in their best interest, their inability to handle the stressors of a loss of a relationship or any other normal stressor, just somebody looking at them incorrectly. All of that, at the end of the day, is related to the brain's functional ability. What Nexalin technology will do is, in a natural, non-invasive way, without any drugs, it will stimulate the brain's ability to regulate itself, as I mentioned, in 3 to 7 treatments. And that is the beauty of Nexalin. So now we can truly treat the brain in an addictive situation. Whereas before, as I mentioned, all we had was really abstinence in the behavior model. Now we can actually correct the physiology associated with the symptoms, because there's always an underlying physiology. It's not just behavior, although it can be a large part of the behavior. But some just can't make a good decision because they functionally do not have the capability, because the brain is so traumatized. And that's what Nexalin's going to do. It's like resetting and rebooting the midbrain, or the area of the brain that's damaged or traumatized from the addiction.
Mm-hmm. Well, that's quite a lot of information, and I appreciate you shared that. Our intention here is to be able to offer the community of recovery, or the community of mental health, some options, and be mindful of some of the things that are out there. And what you're talking about, we really would like to give our audience here an opportunity to connect with that, the ability to get a hold of Nexalin and how they can find Nexalin. How does somebody find Nexalin?
The easiest way is Google Nexalin. There are Nexalin providers coming on board all over the country. And they're in psychiatrist's office, they're in inpatient treatment centers, outpatient treatment centers, extended care treatment centers, naturopaths, it's everything. The new frontier is the brain, whether it's in addiction, brain-based recovery, or health and wellness, brain-based health, and now we're about to see brain-based nutrition. At the end of the day, if you get the brain healthy, the downstream response, or the benefit, if you will, to the patient is a healthier lifestyle, the ability to make better decisions, the ability to handle life on life's terms. Whatever's coming through the windshield, you can process it, make good decisions, interpret the consequences, and then make your decision. In other words, you can handle the cravings and all the challenges of early recovery. So we now become more efficient in the treatment of our patients. And that, at the end of the day, is what this should really be about, is the efficiency and the efficacy of treatment. And that's what Nexalin technology is dedicated to. And yes, we are cleared for anxiety, depression, and insomnia. But all of our clients that have been out in a situation of substance abuse or addiction are going to have one or all three symptoms associated with their challenges. Mm-hmm. Yep. And it just so happens that the way that we treat anxiety and depression and insomnia is by normalizing brain structures and brain neurochemistry. Well, the benefits of that are far beyond anxiety, depression, and insomnia, which is how we get to the recovery community.
This is absolutely amazing. I've been in this industry for almost 20 years, and I see the people repeating the same processes over and over, and I see more people not benefiting from those processes. And most of the time, the people that fail get blamed for being the failure. And there are places in treatment centers in the country that have treatment practitioners that have been in the industry for 15 or 20 years and understand the development to help people get better, build better behavioral patterns, but nobody really has been focusing on what you're speaking about. And I think it's time that we really open up those doors and allow other people to be aware of that. Now, we are getting close on time, so I would like to just be clear. How do you spell Nexalin, And how do you get to Nexalin.com? Because I know that when I think about Nexalin, it sounds amazing, but I might not know how to get to the actual site in Google.
Okay, so Nexalin, N-E-X-A-L-I-N, Nexalin.com, or Nexalin in Google, search, either way, and you'll find your way to Nexalin Technology in its home site, as well as some of the other sites associated with the technology. It's out there, it's here, okay?
Well, I appreciate that, Mark. And just before we wrap up, you know, I would really like for you guys to really connect and get a hold of us and let us know what we could do to better support you. Let us know if there's anything that's coming up in these conversations that you would like to weigh in on, or if you'd like to add to and be supportive to. We really want to value you to bring you the opportunity to connect for the well-being of all of us. And we would really like to offer you to do that as often as you want, and for us to be able to connect back to you and help you with resolve if there's anything that you need. So, thanks so much, Mark White.
Thank you.
I appreciate it.
Have a good day.
You too.
Bye-bye.
Bye-bye.